Breastfeeding is one of the most natural and powerful ways a mother can nurture her baby. Not only does it provide perfect nutrition for the first months of life, it also creates a unique emotional bond between mother and child. Today we'll talk about why breast milk matters, practical tips for successful breastfeeding, common challenges and how to handle them, and when to ask for help. First, the benefits. Breast milk contains the right balance of proteins, fats, and carbohydrates tailored to a baby's growing needs. It's full of antibodies and immune cells that help protect infants from infections, and it adapts over time, changing composition as your baby grows. Studies show breastfed babies have lower risks of respiratory infections, certain stomach bugs, and even long-term benefits like lower chances of obesity and diabetes. For mothers, breastfeeding helps the uterus contract after birth, can reduce postpartum bleeding, and may lower the risk of breast and ovarian cancer later in life. Now, a few practical tips to make breastfeeding easier. Positioning matters. Try the cradle hold, cross cradle, or football hold and find what feels comfortable. A good latch is key. The baby's mouth should cover a large part of the areola, not just the nipple. Listen for gentle swallowing, and watch the baby's cheeks. They should be rounded while feeding, not sucked in. If feeding is painful beyond the first minute or two, gently break the suction by inserting a clean finger at the corner of the baby's mouth and relatch. Feed on demand in the early weeks. Newborns often nurse 8 to 12 times in 24 hours. Watch feeding cues like rooting, sucking on hands, or lip smacking rather than waiting for crying. Offer both breasts at each feed if your baby seems hungry after the first side. This helps maintain milk supply and ensures the baby gets the richer, higher-calorie hind milk. Many mothers worry about milk supply. Frequent nursing, ensuring a proper latch, and fully emptying the breast over time help maintain supply. If you're separated from your baby, pumping regularly, about as often as the baby would feed, signals your body to produce milk. Stay hydrated and try to rest when you can. Stress and extreme fatigue can make breastfeeding more challenging. Common challenges and quick fixes. Sore nipples are often caused by a poor latch. Try repositioning and seek support from a lactation consultant. Engorgement can be eased by warm compresses before feeds and cold packs after. Blocked ducts benefit from massage toward the nipple while feeding or pumping. Persistent painful lumps should be checked by a professional. If mastitis breast infection develops, symptoms include fever, severe pain, and flu-like signs. See a doctor promptly. With treatment, many mothers continue breastfeeding safely. Storing expressed milk. Use clean containers, label with date and time, and follow safe storage guidelines. Breast milk can usually be kept at room temperature for a few hours, in the refrigerator for a few days, and in a freezer for several months. Always follow local health advice for exact times and handling. Let's bust a few myths. Formula is not poison. It's a safe alternative when breastfeeding isn't possible. But breast milk has unique benefits that formula cannot fully replicate. Also, small changes in the mother's diet rarely affect breast milk quality, though certain strong flavors or foods can change taste and some babies might react. Finally, don't hesitate to ask for help. A lactation consultant, pediatrician, or local breastfeeding support group can provide hands-on guidance and reassurance. Every mother's journey is different. What works for one family might not for another, and that's okay. If you're watching this and finding breastfeeding hard, remember you're not alone. Reach out for support, trust your instincts, and take care of yourself too. If you'd like, I can make a shorter version for social media, a checklist for new mothers, or a step-by-step guide to getting a good latch. Tell me which one you want.